Hi, my name is Dianne Koehler. I'm the director of Nutrition Therapy Institute. We're a school that teaches comprehensive training in holistic nutrition, and I have an interesting article that I'd like to share with you today. So I saw this article within the last week or so, published by the Blue Cross Blue Shield, and it's a report called The Economic Consequences of Millennial Health. So the four major highlights from this report are that, number one, millennials have faster declines in health than the previous generation did, and that would be the Gen Xers. They can expect annual treatment costs to be 33% higher than what Gen Xers experienced at the same age. Without intervention, they could feasibly see mortality rates climb by more than 40% compared to Gen Xers. And if the current decline continues, the long-term consequences of the US economy are predicted to be severe. So these four sort of major highlight outcomes from this report were surprising to me because millennials are the most educated and most well-connected generation the world has ever seen. And what surprises me about that is that supposedly people who are well educated are supposed to have better health outcomes. And here we have the largest group of people in the United States right now being the most educated and most well connected who have the poorest or the most rapid declines in health. And not only are they the largest share of the US population, they're also the largest share of the labor force. And this poor health will keep them from contributing to the economy as their predecessors had, and that's because they're going to have higher unemployment levels and slower income growth. And so just for clarification here, millennials are now age 23 through 38, so that's the group of people that we're talking about. So right out of college into just before they hit 40 years old. So they're sort of in their prime employment time period. So they have the top 5 conditions that currently affect millennials are hypertension, high cholesterol, tobacco use disorders, hyperactivity, and major depression. And so what you see here is increases in these top 5 conditions, and those increases happened over a 4-year period. The data that they have is from 2014 to 2017. So for example, you see that in millennials, major depression has increased by 31%, and that was in a very short 3-year period. And these are the top 5 health conditions currently affecting millennials, but the thing to recognize is that they have yet to reach the age where chronic illnesses become primary issues for them. And those chronic illnesses include diabetes, cardiovascular disease, cancer, and autoimmunity. The top 5 causes of death are accident, suicide, cancer, heart disease, and homicide. And I want to point out here the accidents and suicide numbers. Those causes of death are not unusual to be common causes of death, but for millennials, these 2 causes make up a larger percentage of mortality than they did for Gen Xers at the same age. And the overall mortality rate for millennials is also higher than it was for Gen Xers. And that uptick in mortality rate began in the year 2015. So to put this into a little bit of perspective, the accidents category includes accidental overdoses. So that's also going to include deaths from the opioid epidemic that we are now experiencing in this country. So here's the data from the report itself. And what I've done is I've highlighted in red so that you can see that millennials have higher death rates currently than Gen Xers did at the same age. So for example, the 25 to 29-year-olds, top 5 causes of death made up 79.4% of total deaths, whereas for Gen Xers in 2002, those top 5 causes of death made up only 74.6% of deaths. So you can see how millennial death rates are increasing. So obviously the first outcome of a less healthy population is going to be higher treatment costs. As I said, the millennials, their projected healthcare costs are projected to be 33% higher. And not only is that going to affect millennials individually, but it's also going to affect our national economy, because there's going to be higher expenditures for public health care. In the near term, the largest driver of healthcare costs is behavioral conditions. For men, that's alcohol, tobacco, and substance abuse. And then for women, it's depression, anxiety, and hyperactivity. But again, this group, the millennials, have not yet reached the age where the cumulative effects of their current health issues are going to manifest into those chronic diseases. And so the expectation is that their health outlook is going to only get worse as they start developing or getting diagnosed with these chronic diseases. For the millennials themselves, less health equals less wealth. And because they are going to have more missed work days, less productivity, more job loss, they're going to have higher unemployment rates and slower income growth. Because they're going to have higher out-of-pocket spending on healthcare, it's going to limit their ability to spend on other things, which will create additional stress. And so overall, they're going to have less long-term wealth outlooks for millennials. So this has serious national economic impacts, as I mentioned. As states and federal budgets need to support more public health care expenditures, because there's going to be more people who are in lower wage earning jobs. They're going to be qualifying for public health care. Millennials make up, as I said, the largest proportion of the workforce. Right now, that's 35% of the workforce. A decline in worker productivity is going to have drastic consequences for the national GDP, gross domestic product, and it's going to slow overall economic growth. And so right now, the group that is shrinking the fastest in the workforce is going to be the boomers. And then as the millennials, as the Gen Xers start to age out of the workforce in about 10 years from now, when they start retiring, the millennials are going to make up a much larger percentage of the workforce, and the economic consequences are going to get even worse. So the report calls on stakeholders to intervene now to prevent these dire economic projections. And the stakeholders that they're referring to are healthcare agencies and public policymakers. But what they don't say is that the most important group of people that can make change right now are the millennials themselves. And the reason why this is of interest to me is because I think that it's not well understood that nutrition is one of the most powerful ways to impact current and future health outcomes. Nutrition is food is something that we interact with at least 3 times a day, for many people more than that. And because of that, it is one of the best ways to positively or negatively impact health outcomes. And so the people who really need to take action right now are the millennials. Yes, healthcare agencies and public policy makers need to think about this, but it's the millennials themselves that need to take action right now. So it's well established that food choices play critical roles in the initiation and progression of chronic health conditions, particularly diabetes, cardiovascular disease, and even cancer. And we talked about how one of the most common current health conditions affecting millennials is depression. And there are, someone is definitely going to be more susceptible to depression when they have certain nutrient deficiencies. So you can see how nutrition can make a massive impact on this decline in millennial health outcomes. So the reason why I'm here talking about this is because millennials can make changes now that will have an impact on their future health outcomes, as well as the future national economic outcomes. And so the two best ways to do that are, number one, get educated and become professionally trained as a nutritionist, or find a qualified nutritionist who you can go to for counseling. So we are Nutrition Therapy Institute, and so the certification that we provide is a Nutrition Therapist Master. That is the professional training that we provide. And what we do is help people understand how to navigate all the information that's out there, because it's way more complicated than just eat more fiber and avoid sweets. And we teach you how to know what information is actually of value. And not only are we looking at science-based training from an in-depth nutritional standpoint, but also we encompass holistic and functional aspects of nutrition. For those people who don't want to get professionally trained to become a nutrition therapist master, they need to find a qualified nutritionist. And our graduates are going to be the right person to be able to do that, because our graduates understand biochemical individuality so that they can personalize a nutrition program for whatever needs their client has. There are certain qualities of a professionally trained nutritionist that you want to look for. Whether you're thinking of becoming a professionally trained nutritionist or you're looking for one, here are some of the qualities you want to know to expect if you're going to be going to school, or that you want to look for in a current nutritionist. So number one, they need to have training in basic sciences. That includes anatomy and physiology, biochemistry, and the science of nutrients and how they interact with the human body. They also need to have a thorough knowledge about the activities of the digestive system and dietary strategies to support optimal function, because the digestive system is kind of where everything starts in terms of how nutrition impacts the overall body. They need to have received detailed education about nutrient deficiencies and excesses, and know how each of these conditions, each of these situations, negatively or positively influence body function. They need to be skilled at identifying nutritional challenges and be able to provide coaching that's going to help their clients make necessary dietary changes. And lastly, they need to understand that nutrition is, as I said, the most impactful way to achieve wellness goals. And these professionally trained nutritionists need to be able to make it easy for others to learn how to do that. So the report calls on healthcare agencies and policymakers to take action now and make changes. But for the millennials themselves, they need to take those steps themselves. And we at Nutrition Therapy Institute provide two ways for them to start making changes now. That is, number one, they can get educated. And as I said, we provide comprehensive training in holistic nutrition. And we have lots of information about our school on our website, ntischool.com. Or if someone doesn't want to go to school, become a nutritionist themselves, they need to find a qualified nutritionist to work with. And we have a graduate page on our website you can look at. And that is where you can find someone who has been professionally trained in holistic nutrition to help you with making changes that need to be made in order to improve your long-term health outcomes. Whether you're a millennial or not, it's still valuable to see a nutritionist. So please take a look at our website and choose to create optimal health through nutrition education here at Nutrition Therapy Institute. Thanks so much. Bye.